Living with migraine means fighting two battles every day of your life: the battle to function and feel better, and the battle to be heard, seen, and understood. I'm Allie Canizzo. Welcome to the Migraine Circle Podcast by CEFALY, the podcast that gives you expert insights and practical tools to help you manage migraine and get back to life. Today we're talking with Kasey. She's a Master of Science trained occupational therapist, registered yoga teacher, and certified health and wellness coach, specializing in nervous system regulation and whole person healing. She creates accessible, evidence-informed content to support individuals navigating chronic pain, Ehlers-Danlos syndrome, hypermobility, mast cell activation syndrome, and dysautonomia. Thank you so much for joining the podcast, Kasey.
Thank you so much for having me, Allie.
So to kick things off, can you share a bit about your background and what inspired you to specialize in these chronic pain conditions?
Yes, I'm happy to. So I went to occupational therapy school actually not knowing that I have EDS and commonly co-occurring conditions like mast cell activation syndrome and dysautonomia. I went to OT school because I was in a traumatic boating accident when I was 17 and was dealing with the effects of that and chronic pain for very many years after that incident. And I had a wonderful occupational therapist who helped me a lot. And that's what gave me the kind of like ambition to do occupational therapy myself. And then I started having a lot of health challenges in occupational therapy school and afterwards. And it took many, many years to start putting all the pieces together. But once I did and started working through and getting the right diagnoses and being able to treat my conditions, my chronic pain, then I was able to kind of start applying that for other people and helping other people who were struggling with similar conditions. So it was really all a lot of personal experience.
Yeah, I'm sorry to hear about your accident and then the conditions you were dealing with, and I'm sure took a long time to get properly diagnosed and get the right care, but I'm sure that really helps the patients that you see.
Yes, actually, it does a lot, and it's the median age for diagnosis for EDS is in mid to later 30s. So I actually got lucky to be diagnosed earlier, and I'm even lucky to be able to have these experiences, as challenging as they were, to help a lot of different people who are struggling and don't have the resources to know what to do or the steps to take to feel better.
Mm-hmm. And then for those who may not be familiar, can you briefly explain what Ehlers-Danlos syndrome, mast cell activation syndrome, and dysautonomia and POTS are and how they tend to show up in patients' lives?
Yes, I can. And I'll give a brief overview. These are pretty complex conditions. So I'm just going to give kind of the easy breakdown of each of them. There's a lot more information on my page and different evidence-based resources online. But as far as kind of a general overview, Ehlers-Danlos syndrome is a group of connective tissue disorders. There's no real root cause of EDS. It's genetic. So those conditions, there's 13 different types of EDS. The type of EDS that I have is called hypermobile EDS, and it's one of the more common variations of EDS. And it's also related to hypermobility spectrum disorder, or hypermobile spectrum disorder, so HSD and HEDS. So they're very much related and they share and overlap in a lot of different areas. And really, the hallmark of this condition is hypermobility, which means that your joints are hyperextend. So they go past normal range because of a lack of strong connective tissue to maintain that integrity of the joint within normal range. So what happens is that puts a lot of stress on joints, and connective tissue is actually everywhere in the body. It's a complete web. It encapsulates all your muscles, your organs, everything. So the reason why EDS is so systemic is because you have connective tissue everywhere. So like it can really affect all different types of body systems, organs too. So your connective tissue, we see different things with like pelvic floor health and prolapse and things like that with EDS. So that's with hypermobile EDS and hypermobility spectrum disorder. And then underneath kind of the EDS umbrellas are a lot of different conditions. So dysautonomia is an umbrella of dysfunction of the autonomic nervous system, which is very common with EDS because of the loose connective tissue and the less stability in the body than if you did not have EDS. So The dysautonomia most commonly occurring with EDS is POTS, so postural orthostatic tachycardia syndrome. This is a condition where you have a increase in heart rate with position changes, or a severe decrease in heart rate with position changes. So that's the tachycardia, that's the high heart rate. And that can cause things like syncope, so fainting episodes, and a lot of other symptoms, very bothersome symptoms. So that's the POTS dysautonomia umbrella. There's a lot of intricacies in there that I probably won't get into, but that's also related. And then MCAS, so that's mast cell activation syndrome. That is also very common in EDS because your connective tissue is home to millions, billions of mast cells. And because the connective tissue is loose and kind of irritated and moving all of the time, the mast cells can release histamine. And when you have that high level of histamine, then you can have the symptoms of mast cell activation syndrome. So that is also systemic. Most commonly, people have like allergy type symptoms, but it actually can affect things like it actually can increase your heart rate, temperature dysregulation. Mast cell activation syndrome is affects every organ system because there's mast cells everywhere too, just like connective tissue. So all of these together, and this is a somewhat brief description, but basically what we're seeing is systemic responses to loose connective tissue within each of these. There are people who can have mast cell activation syndrome and any type of dysautonomia without EDS. And there are people who have EDS who might not have any type of dysautonomia or any type of mast cell activation or histamine issues. So it doesn't always go together, but it commonly does. So that's why I bring it up, because a lot of patients, they might get that EDS diagnosis or they might get that dysautonomia POTS diagnosis. But sometimes knowing about those other pieces can be helpful just to put the pieces of the puzzle together for the patient.
And it must be so hard because so many patients live with the overlapping condition. So it's just our bodies are so complex. So could you
So
tell us a
complex.
little bit?
Yes.
Could you tell us a little bit about the symptoms you were experiencing and then like common symptoms that your patients experience?
Yes, I can. So really my two biggest symptoms would be chronic pain, so joint pain, severe muscle soreness, and really just generalized pain, but in specific areas of my body as well. So specific joints that maybe were a little bit more unstable and had a lot of issues with dislocations or subluxations throughout my life. I would say migraines is actually one of the most common symptoms or kind of like co-occurring conditions. Migraines and headaches, a lot of my symptoms related to headaches, migraines, from a young age before any of this was put together. Tachycardia, so fast heart rate, was a really, really high symptom on my list. That was super common. There were quite a few that would like come and go. So of course the pre-syncope, so the almost feeling like fainting episodes, getting really dizzy. An interesting symptom that a lot of people have, but they don't really know is related, is trouble swallowing. So I'd have a lot of trouble swallowing things like starchy foods. So those were kind of my major symptoms. I'm sure there are more. I probably just like try to not think about a lot of them.
Yeah,
But,
that makes sense.
but yeah, those are probably the biggest ones.
And I know you said the path to diagnosis, especially for Ehlers-Danlos syndrome, was typically when you're in your 30s, you said?
Yes, typically it's actually not well understood. It's not well recognized. And so of course all of that makes it hard to diagnose. And it's hard to find a doctor who will diagnose EDS or has the understanding or training in that area.
Yeah, so what do you think some of those common misconceptions are that delay diagnosis and care for conditions like EDS, MCAS, or POTS?
Really? So it kind of goes back to everything being so systemic. So when you have a patient presenting with kind of this laundry list of symptoms, I think what happens a lot of times is the provider kind of gets overwhelmed because if they're not trained and aware in these conditions, it's kind of like you're reporting issues with all these different areas, all of these different organ systems, all of these different systems in the body. And so what happens is the patient typically gets like siloed into specific areas. So if GI symptoms are the worst and they're going to go to GI, but GI might not be trained in EDS. And so then they're treating IBS, but that's just a tiny component of EDS. So basically, we all get kind of siloed off into our biggest concerns. And then maybe those are treated, but we're not looking at maybe what's causing that. And so I think that's the biggest issue with getting the right diagnosis is lack of awareness and then finding the right provider. But a lot of patients have no idea that they're dealing with hypermobility or I think there's a trouble understanding how being hypermobile in an extreme way could cause different symptoms in the body. So a lot of doctors are like, oh, you're hypermobile. That's great. You're very flexible. That was always what I heard is like,
Oh,
that it's
no.
great to be flexible. That's wonderful, you know? And if you actually look at it, you see kind of a different story. So I think that prevents diagnosis. I think really the systemic issue, it being so systemic is just very confusing. It's oftentimes written off as psychosomatic. So it's oftentimes written off as anxiety or that it's made up in the patient's head. So that happens a lot. You can't see pain. A lot of people with EDS, MCAS, dysautonomia, they're young, they're mobile, they're active if they can be. And so it's interesting, but it just is not well recognized.
And it's so frustrating when you're going and you're having this list of symptoms and then it's just dismissed as being anxiety or just being in your head when these symptoms are so real and debilitating.
Yes, so real and debilitating. I mean, I had to leave. I was working as an OT in the hospital for a couple of years, and I actually had to stop that because of the physical symptoms. And having to stop that without a real reason other than like being in so much physical pain is really hard when you look active. So it's very interesting. And a lot of patients end up kind of gaslighting themselves because they're like, well, I should be fine. I should be okay. Why do I have pain? This doesn't make sense. And so I talk a lot about validating your pain, validating yourself, understanding your body, understanding the signals that your body's sending you, because a lot of like the medical gaslighting can kind of bleed into our own gaslighting of ourselves.
Yeah, that's so interesting. So you had mentioned that migraine is one of the most common co-occurring conditions for people with EDS, MCAS, or POTS. Could you tell us a little bit more about your patient's experience with migraine and how it tends to show up alongside these conditions?
Yes. So migraine is also very complex, as you know. But if you think about it, the main things in migraines, I guess, we're looking at nerves and we're looking at blood vessels. And so when patients have anything like dysautonomia or EDS, if you think about it, that's going to be blood vessels and nerves because nerves are all in the connective tissue. So basically, it's going to be very common because you're going to have blood flow changes with dysautonomia. You might not be getting a lot of blood flow to the head. Same thing with EDS. Like if you have loose connective tissue in your neck, the nerves can be firing and causing pain in that way. So it makes so much sense why there are so many patients who have dysautonomia and also have migraines and EDS and also have migraines. Same thing with mast cell activation as well. The nervous system is on high alert. The nerves are firing, histamine's being released. Very, very common symptom with mast cell activation as well.
And I know that chronic pain paired with migraine, POTS, or MCAS can feel extremely overwhelming. So,
Yeah.
what are some of the common challenges you see in your patients that they face day to day? I know you talked a little bit about the gaslighting of their own feelings and pain, and the mental health component.
Yes, for sure. So all of that is challenging. I would say management is challenging as far as medication goes. So a lot of people with EDS, dysautonomia, MCAS are very sensitive to medication. So finding the right medications that work for the patient's very challenging. Migraine medications specifically, very challenging because a lot of migraine medications can cause symptoms that make EDS, MCAS, dysautonomia worse. And so those are really hard to take with with those conditions already. So medication management is really hard. And then lifestyle modification too is how do you kind of plan your life around your pain and your migraine? So I do a lot with routines. With a lot of what I do is with prevention. So how can we prevent a migraine? How can we prevent a chronic pain episode? How can we prevent something like that? I mean, obviously we need acute treatment 100% for specific things. We need rest. We need all these things. But I really talk about like a nervous system toolkit. And so that can help with that support at baseline, just because when we're trying to treat all of these different things acutely, it gets pretty tough. So I would say, yeah, medication management is huge. And then having that plan of action, really, that baseline plan of action, that's really important. But otherwise with management, I mean, there's so many different things that go into it: hydration, electrolytes, all of these different components. So it's a complex it's complex to manage this condition.
And I love how you talk about that nervous system toolkit. At CEFALY, we're always talking about that migraine toolkit.
Mhm.
So that leads perfectly to the next question about how can neuromodulation devices like CEFALY that are drug-free migraine treatments fit into a comprehensive treatment plan?
Yes, I love tools like CEFALY. So that's really the whole basis of what you do as an OT, or kind of what you do as a nervous system OT. Is what I do is create that toolkit, that strategy, that routine for the patient that allows them to integrate as much as they possibly can into like a normal life, or the life that they want to live, to do the occupations of their life that they want to do, whether that's that an occupation of life can be anything. So having a tool like CEFALY, what I love about CEFALY is that there's two parts, right? There's the prevention and the acute treatment. So with a tool like CEFALY for my patients, we can work this into a daily routine that is going to help prevent migraines. And then we can also use it as a tool when we have an acute migraine attack. So it's very easy to put into a routine. And I have a lot of different tools that I use, like vagus nerve stimulators and compression devices and red light mats and all of these different things that are part of this larger toolkit for this patient. And it works really well because it works with the nervous system. You're working with the nerves, so you can really make it as part of like a grand nervous system plan that is great for patients with a nervous system disorder.
Mhm. And then how did tools like CEFALY help make migraine relief more accessible and practical for your patients? Do you have any
Yeah.
stories that you've had with patients who've used CEFALY?
I mean, anyone who's listening to this probably already knows this, but chronic pain management, migraine management, healthcare in general, but especially with chronic illness, it's very, very costly. And so a lot of my patients were doing things like injections that cost $4,000 every 3 months. I mean, things that you can't even imagine the amount of resources that go into. I mean, you can if you're in it, but that go into paying for and taking care of health like this. So I always appreciate devices where it's kind of like a one-time purchase and a long-term use. So you invest in the product, or you invest in the resource, like a couple of my nervous system resources, and then it's part of your routine for as long as you need. And so I really like something like that. I also like tools that are really, I mean, I do prefer drug-free options as much as possible, just because of the sensitivity to drugs and the side effects. But obviously, there's a time and a place. There's a lot of reasons I think things like CEFALY and different nerve stimulators are helpful. I don't like to use the term hacking the nervous system, because can't really hack the nervous system, but I
Mhm.
think you can have these tools to support nervous system health, and I think that is incredible.
Mhm. And it's so important to have these kinds of tools, especially with CEFALY, since there is the acute and prevent treatment. So how do you feel like your patients, do you think they're using both treatments or one more than the other?
I would like to say both. I do a lot. Really focus a lot on prevention. I think it's something that's overlooked in healthcare. So we kind of just look at treating. So I would say both, but I definitely recommend it as a tool. Even knowing that you have a tool can be helpful for bringing nervous system dysregulation down. So even knowing that you're doing something to prevent a migraine, even knowing you're doing something to treat an acute migraine is going to be helpful in bringing that nervous system like upregulation where you're kind of getting into that fight or flight. Oh my gosh, I'm having another migraine. That really gets you all kind of like stirred up and can kind of elevate the nervous system into this state that makes it harder to come down from a migraine or a different kind of nervous system episode. But yes, so I would like for them to be doing both. A lot.
We would too, for sure. And it's great. I feel like we hear a lot too from patients about just how comforting it feels to be able to have a tool like CEFALY in their toolkit, that when they feel a migraine coming on or they're doing an event that they know might trigger an attack, to know that they can come home and do their CEFALY treatment. And so many patients find it to be really soothing just
Yes.
doing a CEFALY treatment. So that mental component is important too, besides the physical.
Yeah, and it's also part of like a routine. So having those routines that's very regulating to the nervous system. So bringing CEFALY into the routine, that's regulating in and of itself, and having that time set aside is also regulating. So that's going to be quiet time. You're going to be resting. You're going to be lying down, which is really important for my patients to be. I love my patients to be horizontal sometimes. Like these are all part of it. So they're getting that horizontal time. They're getting that restful state. They're pulling their nervous system out of the sympathetic activation, and they're doing the treatment for migraines. So there's so many benefits of having that as part of their routine.
Yeah, do you find that your patients often like push themselves a little bit too hard? Because I know there's so much stigma around chronic pain and seeing rest as being something lazy instead, when it's really essential.
Yes, and I will be honest, this is something I struggle with so much. I mean, it is so challenging we just live in a world where really success is based on productivity and everything that you do. And so it's pretty much just ground into us from a very young age that in order to be loved, be cared for, be anything, you have to be doing. And so, and achieving and all of that kind of stuff. So nervous system work, all of this work too, is kind of like bringing down that pressure that we're putting on ourselves, the pressure that we're putting on our nervous system. And it's so hard for me to do it because that's just how I am too. Like I'm just an overachiever. I want to do everything. I want to be active. I want to get all my steps in. And that's great. But in order for the nervous system to kind of find a little bit of rhythm, as we do have to have those times where we come into that parasympathetic state and out of that sympathetic activation so that the nervous system can kind of regroup. We call it rest and digest. And so that is super, 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 super important because it triggers cues of safety to your nervous system. And when your nervous system feels safe, then it's going to be able to have a healthier response to stressors. So we kind of like want the nervous system to ride a little bit of wave. There's no such thing as being regulated all the time. That's completely impossible. So having those times of activity and then rest. And sometimes we need a little bit more rest. And sometimes we have a little bit more activity. And then sometimes we crash. Like this just happens. And so a lot of times it's learning to stop before you go too far. But that can be really hard. That's like there takes a lot to do that. It's really hard for me to do that. And so a lot of it's just learning. For females, there's certain times of the month where it's actually more important for rest. And there's certain times of the month where a little bit more activity is possible. And so there's so many different intricacies to rest. It's just hard. It's hard to figure out what you need. And it's different for every single patient. And I think another component of this is that sleep can be really challenging. It can be challenging in migraines. It can be challenging with EDS, dysautonomia, MCAS. The patient needs to look at how much sleep they're getting. And if they're not getting enough sleep, then we need to take that into account with how much activity and how much rest we need. So there's just a lot of factors at play: nutrition, hydration, all of these types of things. But rest is so important, and having that set aside time when you're using CEFALY and doing some nervous system work, that's going to be part of that rest. That's going to pull you into that parasympathetic mode for rest and digest.
Mm-hmm. And I know we talked a little bit about how migraine brain does love routine. So, what advice do you give someone if they know there's going to be something that breaks their routine? What are some suggestions you give them to prepare for that?
Yeah. So that's when we really kind of beef up the toolkit and get really prepared. Maybe if maybe we're doing a couple more of the preventative treatments for like using CEFALY, or maybe we're looking more at how can we prepare to take our toolkit with us. That's something I like about CEFALY, is that you can travel with it, you bring it with you, and you can use it while you're on the trip. And so because what happens when we have these like more activity or vacations, really what it's doing is it's taking us out of our routine. And like we said, the nervous system loves routine. And so when the nervous system is out of routine, that's completely fine. Like that's life. But we do need to have a way to kind of like bring parts of our routine with us or prepare for the routine to be changed. So yeah, really, I mean, bringing CEFALY on the trip is helpful because it's bringing part of the routine with you.
Mm-hmm.
So yeah, I mean, there's lots of different ways to approach changes in routine, but keeping pieces of the routine with changes is really important.
Mm-hmm. And then overall, how can we help patients and even healthcare providers better understand chronic illnesses so that people aren't feeling as dismissed or misunderstood than they are right now?
This is such a hard
It's a
question.
tough one. I know
Such
it's a
a
tough
hard
question.
question. A lot of people ask me this. They're like, what doctor? Who do we go? That's such a hard question to answer because there's just so many components that go into this, and there's insurance, and there's access, and there's all of these different things. There's cost, and so I think, and this is kind of a slippery slope, but obviously you find providers who understand your conditions, or you find really open-minded providers who are willing to learn more about a condition or be open-minded to looking into your symptoms and having a little bit maybe of a better understanding of what's going on. So those are two routes. The other route is there are a lot of external resources that you can use to support symptoms without going to provider, or maybe you've gone to 20 different providers and nobody can help you, but you're like, I'm really struggling with this specific thing. What can I on my own go and do? And that's what a lot of what I had to do for about 15 years is go and find, okay, I have this going on. What do I know that I can do to help treat this? And the thing is now there are a lot of resources like CEFALY and like other similar things that the patient can purchase without a prescription. And so that can be really helpful. Is yes, the medical system is really challenging, and yes, it can be hard to get a diagnosis, but we actually have more access to tools that might be even more helpful than just a diagnosis. So that's what I try and remind patients is like the diagnosis isn't everything, but you feeling good is everything. So that's kind of the direction I try and go in. I appreciate doctors and physicians, and everybody's doing the best that they can, but the resources in the medical community are unfortunately lacking, and there's a lot of different reasons for that. But that doesn't mean that you shouldn't feel good. So let's find tools that can help you feel good, whether or not a provider needs to prescribe them or not.
Exactly. And I feel like it gives you so much power too, being able to do something for yourself because navigating the healthcare system is not easy for people with
No.
chronic illness. So being able to be your own advocate and kind of continuing to seek out even when you kind of feel like you keep failing or things aren't improving is so important.
Yes, 100%. It's so important, and to keep hope too, right? It's so easy to go into a doctor's appointment and leave and feel like all your hope is crushed. But the thing is that doctor doesn't hold your hope like you do, and there's a lot of things that you can do that are different than seeing a doctor that can be helpful.
Yeah. So, what advice do you give patients who feel overwhelmed by their symptoms and maybe are losing some hope?
Yeah. So I think if you talk to any chronic pain or chronic migraine, EDS, MCAS, any of these patients, they're going to be overwhelmed by their symptoms because their symptoms are systemic, like we started out talking about, and there's so much going on. Even migraines are like you have all different types of symptoms with migraine. And so what I try to do with myself and with patients is really take away this list of things we need to fix right away. So we're going to set the symptom list aside, and we're going to, if you follow me, you know that I love working on inflammation first because I think that's super important. But we're going to work on inflammation in the nervous system. And so we know that the majority of chronic illness has some relation to the nervous system. And so when we can start to slow down, when we can start to come into parasympathetic mode, we can start to do use some tools to help begin to regulate those waves of the nervous system rather than staying really elevated all the time. That's what I try and do to help pull out of overwhelm. I also I use my story a lot too. There's a lot of different patients who I've worked with or who have used my resources who have very similar stories where they've been in chronic pain for a certain amount of time and they've found that this routine works for them. And so really, I just try and break down the overwhelm by pulling the focus away from that list of symptoms and then just coming to tools. Like, what are we going to use for a tool? Let's start with one tool. And then we can add another tool when we start to feel like we can. And then we go from there. And then once you have your tools and routine, then your nervous system gets to a spot where you can start maybe looking at the symptoms. Okay, what do I still have? What's still going on? But let's get that routine and those tools first, and then try to bring that overwhelm down. That's really important.
That is so important. And I'm sure it really helps to have someone like you that can break it down like this and give them some more hope being able to see your story and how you're able to manage your conditions now a little bit better.
Yes, a little bit better, and it's always waves. Like there are always
It's
waves.
never over.
Yeah.
Yeah. It's not just like a
Yes.
one cure. It's all about
Mhm.
managing.
It's all about managing, and that's okay. Like I think a lot of it is acceptance too, right? It's like, all right, this is what I'm working with, and that helps a lot. And same things with migraine. It's like, okay, I know what this is. I have a tool. Well, let's work with what we have. And so that's just how we kind of have to look at all of this. I mean, it's tough stuff. So it's not easy to dissect, and it could be kind of traumatizing looking at what everything you've gone through. And so, just having those tools and being able just to kind of move forward.
Hmm. So, where can listeners learn more about EDS, MCAS, or POTS and connect with you?
Yeah. So if you want to connect with me personally, my Instagram is at thenervoussystem.ot. And then I'm also on TikTok. It's Wellness with Kasey. So those tools, my website and everything are going to be linked on those. And then all of my resources will be linked there too. I'm working on an app that's going to have a couple of the nervous system exercises that I recommend too. So that'll be coming out. You'll see that on social media if you want to start to work that into your routine. And then to learn more about EDS, I definitely recommend the EDS website. There's going to be tons of resources and tools on there, as well as lists for providers in your area that do have training in EDS. And then MCAS and dysautonomia, those are, it's a little bit more tough to get accurate information on those. It's really, really, really tough to get an MCAS diagnosis. So that can be tricky, but there is an MCAS toolkit on my social media pages and website. And then I also have a dysautonomia POTS resource that's kind of like a POTS survival guide that's been really helpful for people. There is a little bit more research and information coming out on POTS because it's just extraordinarily common, especially for people with things like long COVID and a lot of different post-viral infections. POTS is very common. So there's more information coming out. I'm sure there's a lot of resources online. I always try to look for things that do have evidence-based. So there's research information on those articles. And I try to include as much research as I can on my posts as well. So there's a lot of resources out there, but just try not to get overwhelmed with too many different things. I think finding a couple of things that are helpful is a good place to start and then building from there.
Well, thank you so much for coming on to the podcast today, Kasey. This was such an enlightening conversation, and we definitely encourage our listeners to check out your Instagram and TikTok and your website. And for anyone looking to explore new ways to manage migraine, CEFALY can be a powerful part of your relief toolkit. You can learn more at cefaly.com. Thank you again, Kasey.
Thank you so much for having me.